Good morning for everyone, and thank you for the invitation. So here in Germany, it's already 2 o'clock, and you guys, I'm going to start a fresh new day. And today I'm going to talk about how to keep up to date in urology. It's a topic that I had to in the last years because of the platform that I'm responsible of, Nouro. It's a topic that I have been trying to do my best to also be up to date. So here I'm going to tell you how do I do it, and I will give you a few tips. So I'm a urologist working in Berlin, as I already told. So let's start with my disclosures. I'm the owner of Nouro. I'm the writer of the book From Nouro. And the first question is, why do we actually need to be up to date? When we start medicine, studying and medical school, we have to know the basic knowledge, the basic science. So being actually up to date, it's not that needed, because we have to start our knowledge in the basics on the fundamentals of anatomy, chemistry, and biology. But when we start working as a resident, then we start feeling the pressure of having to know the latest news. Because at the end of the residency, we will have an exam, and the exam, usually the questions that are asked are concerning the year of the exam. So we have to know all the knowledge of urology plus what came out new in the last year, for example. And as a researcher, we also have to be up to date because it's a situation where we always have to know the latest innovations by the colleagues in the same field, and that also help us to avoid double work. If there was a paper recently published saying that these research fields produce negative results, this will help us to save up work and repeat the same study. The other hand is when we see a publication, when we read a new publication, maybe we get inspired by their work. We can analyze the paper and see, okay, I would do different, I would choose another cohort. So reading a lot of papers from our fields help us also stimulate our desire to learn more. And also as a clinician, it's also important to be up to date because it's our responsibility to provide the best care for the patients. So we have to know what are the latest recommendations and try to bring this to the clinical practice as soon as possible. So now we are in a new generation of doctors in medicine. We are suffering somehow from information overload. This is because of the globalization and the internet. So nowadays, we receive so much information from all platforms, from YouTube, from our colleagues, from Twitter, from PubMed, and it's sometimes really overwhelming to choose which tunnel of information we want to be aware of. And this problem, I think it will get worse and worse in the next years and the next generations, because additionally, we also have the pressure of being up to date. So it's two situations. We have a lot of information and we have the pressure of trying to know everything because of our oath. So here is an example of a systematic review. It's already an old paper from 2005 that says that the more years the physicians practice, less likely is that they adhere to the standards of practice. So this might be because it gets overwhelming to always each year know what is new and what should have been done and new recommendations. So in this study, they also showed that there is a negative association between the age of the physician and the adherence to standards of appropriate use. Again, so being up to date is critical, especially in our profession. So here is just an example. I just went to PubMed. I wrote prostate cancer, and in 1 year, in the last year, it came out almost 10,000 articles. And for urothelial and renal cell carcinoma, when we sum everything up, it can go to 15,000 articles that came out in 1 year. And we think, where should I begin? Which articles are important? How am I supposed to know everything? And that's why I think this masterclass might give you some tips. And not only on the academic side, we also see on the pharmaceutical side, on the clinical basis. Here is an image from Nature, Drug Discovery, that shows us also this evolution of information, and the volume of new drugs coming out is also overwhelming. An example is, we know that in the last years, immunotherapy started coming to urology, and we can see here the difference between 2017 and 2021. It almost doubled the number of clinical trials. And again, we ask ourselves, which clinical trials I should follow, which one results came out new, and where should I begin to read the results of the clinical trials. This is an image not for urology, but in general medicine, how the situation is with an example from immunotherapy drugs. So the situation is tough. I think especially for doctors that are in the beginning of the career, because in the beginning we have to know all fields. So it's difficult to know everything about urolithiasis and uro-oncology and incontinence. And I think being up to date, in my opinion, it gets better in the years later when we specialize in one field. So it's easier to track the latest news. And so I'm going to give you some ways to keep current in urology. The idea is how to filter this information. So the first one is obvious. We should attend international or national courses. There are multiple platforms. We could choose international, for example, from the EAU. They have an European School of Urology where they provide master classes, e-courses, and webinars. The AUA University also provides multiple courses, and of course the national courses organized by the urological associations, local institutions or hospitals, like this masterclass that is planned. So it's always, what I do is when I start the year, I try to see the calendar and try to see which classes I want to take this year, because there are so many and we have to organize ahead. So what are the advantages of participating in a webinar or in a course? You can choose a specific topic to learn or review. So if you are a specialist in incontinence, you just will choose webinars about this topic. It's an intensive learning way. It means that you sit down and you hear intensively for 1-2 hours. So it's a great way to get an overview of diagnostic methods and treatment landscape. And sometimes the webinars also give a future idea what is coming next. and when possible, on demand. I think this is also very good, that if it's on demand, we can schedule our agenda to find the perfect time slot to attend a course. The disadvantage, if it's in person, it's sometimes time consuming and difficult to put in our agenda because of our work or other reasons. Another way of being up to date is attending conferences. So this is a bit tricky, the conferences. We all know that there is international ones. We have ASCO, Uro-Onco. Uro-Onco is a new international conference from the EU, only dedicated to oncological diseases. Then we have the EAU, AUA, SEU, and of course the national congresses. And sometimes we know about the congress when it's already was done. So again, a tip is try to schedule your year. You can go to the AUA agenda or calendar or the EAU, and you just filter what you want, and they will give you the dates. An example is that the AUA also speaks about the Colombian Urological Association, the Congress, which now I know that will be in August this year. So the advantages of attending a conference is that you have the opportunity to meet the experts. So because when a feeling that I have is, one thing is when we read an article or an expert opinion or a clinical trial, and the other thing is when we hear the experts talk about their work. Because to give an example, when we read a clinical trial, it seems like they had this idea, then they make the clinical trial, and these are the results. But when the expert talks about the clinical trial, they'll explain the history. They explain why at that time they decided to do the clinical trial. So you have a better idea of the process of research, and they explain also, they have the opportunity to explain better their work. At the conference, it's the perfect place to know, to learn the latest news and innovations. It's where the clinical trials results are usually published and talked about. And another opportunity is when we are at these conferences, at the end of the talk, we can ask questions directly to the experts. So that's also a big advantage of attending conferences. But of course, there are disadvantages. For example, some conferences are expensive, and usually they are not time efficient. It means that if you go to a conference and just passively go to a room and sit down and listen to the talks, it's not going to be time efficient. So you should see the schedule of the conference and book what you want, and then you have to move between rooms, because you have to decide the objectives, your goals for this conference. Is it to learn? Is it to meet people? Is it to see the poster? So try to set your goals before going to the conference and organize your scheduling. And sometimes the conference, because they are so broad, there are a lot of irrelevant topics for your needs. So the other one is reading the latest guidelines. So there are multiple guidelines worldwide. The most commonly known are the international ones from the American and the European ones. And of course, there are also the national guidelines. I also went to your site. I found also that you have a lot of guias clínicas. So because we have to keep in mind that this international or European association, that they write the guidelines, but they are not written for each country, because one thing is writing a recommendation, for example, writing every patient before a biopsy for prostate cancer should receive MRI. But maybe that's not possible in all countries to do because of lack of resources. That's why I think it's critical that to read the international, to have an idea what they recommend, but also follow the guidelines, the national guidelines. So advantages of reading the guidelines is because it's actually a great result, a great work of curating articles, information, clinical trials. The experts summarize everything for us actually, and this results in direct clinical recommendations. So it's immense work from the experts, and we should take this not for granted. But there are also disadvantages. Reading the guidelines is very, very time consuming. They are very long, and when we are at a clinical practice working and we want to consult something in the guidelines, most of the text, it's not relevant for the clinical setting. Of course, it's important to read everything because then we understand the recommendation, which data it was used. But when we are in a hurry, trying to remember what was the recommendation, sometimes it's a bit overwhelming, the guidelines to follow. So another way to have the latest information filtered for us is through subscribing to urology journals. There are also, again, multiple urology journals. You have to find your own, the ones that you like to read. They are a bit different in the way they write, in the way they present the results, in the also the topics. So my recommendation would be to choose 3-4 journals that you think that you're most compatible, and then use some notification apps. Here are some examples. I will explain the few of them. So it's difficult for us to always go to the urology journals and check what was published in the last month. So there are apps that help us do this. You have the Google Scholar that is in the academic world already well known. You just write your wishes, your filter, and then they will give you a notification. There is Stork also. The Stork is the one that I use. And there is also the journal Talks. I will explain how Stork use. I really enjoy it a lot. So Stork is an app that uses an algorithm to find the best or the latest publications and grants. So in my case, I went to this app and I wrote my fields: penile cancer and testicular cancer. And weekly, I receive an email that looks like this. It says up how many publications on this topic exists, and then they write the name of the paper. They write also the journal, the impact factor. So I find it really practical. I just open the email, I read the paper titles. If it's something that interests me, then I just have to click it, and it will resend the link to the paper itself. So here, for example, for testicular cancer, there is a direct link to the journal. So I think it's a great way to filter the latest publications. Another way is the journal Talks. This is a website, and in the past, Talks means table of contents. So in the past, the librarian would receive from the journals the table of contents, they in the paper form, and they would give to the employees and they would have to read it and choose the article and go back to the librarian and tell, I want to read this. So in the past, it was more complicated. So with this website, and thanks to the internet, we just have to, here on the left side, write journals. I wrote, for example, urology, and then it came out 47 journals, and you can choose the journal that you want, and on the right side it will come out the table of content of that month, or if the journal is every 2 months, it depends, but it comes out the latest table of contents. I think it's really practical. You just read it, and if it's something that interests you, then you know where to find it, click, and then read the article. So advantages, journals and articles and these notifications help us get the latest news, but there are, again, some concernings. We have to, unfortunately, most of the articles that come out, they do not have a direct link with the clinical setting. So it depends if we are doing research or only working in a hospital and in the clinic. Sometimes the academic world does not have a direct link with the clinical setting. So sometimes that's annoying. And the other thing is that journals and papers are sometimes very expensive to read. Podcasts. That's another very practical way of knowing the latest, or even make a review about the topic that we forgot. It's more for setting, and a good example is when we are going to work in the car or in the transport. We can choose a podcast. Here are some examples of some podcasts. There is from the EAU, Backtable Urology, the Urology Docs podcast. You just choose one and see if it's something that you enjoy. Personally, I do not learn a lot by hearing. I'm more of a reading person, but there are a lot of people that enjoy learning while hearing, and podcasts are then the best way for them to learn. And this one, get active on social media. This is close to my heart because of the platform that I have. From the last years of my experience is, I just want to tell you that actually we all know social media, it's a tricky place, because we have the journals, and the journals curate the information for us. So we assume that what is being published in this journal, it's good material. In social media, there is no filter. So who has to do the filter is you. You have to be critical in what you are reading, and you have to be critical in what you are sharing. Because if you're sharing bad information, then you're part of the problem. So a way of averting this kind of misinformation is, when you log on, when you make a new account, try to follow the most influential experts on the field, see their kind of tweets and see if you concur with what they write, and if yes, you should follow them. And it's also a great platform to contact them. I personally already contacted a few experts. For example, I saw a study, a clinical trial, it was published, and I want to use this new treatment, but I have a few questions. I sent a message through Twitter, and surprisingly, I received an answer. So don't be shy to contact the experts on the social media. And I just read that the Twitter is one of the preferred social media platforms to share knowledge in the healthcare professionals. So some Twitter pages, here are some examples. I'm going to focus more on Twitter because it's the platform that I most use, and I like the most. Of course, you have also YouTube, which is a great place to learn about surgical techniques. Yeah, most surgeons like to publish their videos there, which is great. And TikTok, it's not my favorite app, but so I will focus a little bit on Twitter. So when we enter in Twitter, my recommendation would be to start following the big Twitter accounts of urology from big associations, for example, EAU, Grand Rounds Urology, European Association Open Science. That is the journal, and there is also the Endo-Urology Academy, really interesting. So you just choose your fields. I did not focus on individuals because that is really personalized. You should follow your experts. Choose the individuals that make more sense in your field. And one thing that I found in Twitter that I just adore is because you start following a lot of people in Twitter. So it means that your notifications, your feeds is getting long. And it's Twitter, it's a social media. So people will post about their morning drinking coffee or their trip to Paris. And when I go to Twitter, I do not want to see these kinds of posts. I go to Twitter in a professional way to work. So I found out that you can filter the content, which means that you can create lists. So here's an example of, there's a screenshot of my Twitter account. And you can see here that there is for you, there is a list of following, which is very, very long. And then I have my own list of the people that I want to follow. And then I have a list for EAU, and then I have a list for urologists. So throughout the day, when I wake up or I go to bed, I just check the lists. That's for me, it makes much sense. And it's really, really practical. So here is my platform. I already talked about that social media is close to my heart. So Nouro, the idea of Nouro is came up when I was still a resident, which I felt the need something fast and practical, and because the textbooks are usually really long, and I wanted something to sum up everything before the exam, because I spent 6 years reading the big books, and of course I forgot some information. So I thought, how can I just sum up everything to make a good revision before the exam? So I use the social media to just give these small informations for my audience. Lately, I've been telling or giving information about the changes in the EU guidelines, but it all started as a platform to share knowledge, common knowledge of urology, anatomy, physiology, things that we actually in the clinical practice forget to study. I just popped some of this information. It looks like the people enjoyed it. Another feature of my platform is these flow charts that you can see on the left. This again was an idea that came up in the last year of my residency, which I felt that I was studying, for example, prostate cancer. And then everything is broken. I had a screening, and then another chapter diagnosis, and then another chapter treatment. And I had the idea like, I want to put everything in one page where I can see from the beginning, patient comes with suspicion of prostate cancer until the last treatment option for the patient for metastatic disease. So it came up these flowcharts, which I always have to update yearly. And it's based on the EAU guidelines. So this topic about being up to date is something that I have to do daily. So through social media, attending conferences, courses, reading the guidelines, reading journals, talking to experts, I just sum this information all up, work the information to see which is the best option to give back information that is shorter. So I produce books and I make these flowcharts, and this is like something that I really enjoy doing. So here is an example. If you go to the website, I give for free the flowcharts, because I think that I myself, when I'm working and I don't remember a second line treatment for renal cancer, I just go to the flowchart and check them out. And I'm currently doing the revision, because the guidelines came out in March. So I had to read all of them, and I'm now doing the updates of the flowcharts. And the book on the right, this is the cover for 2022. And this is because this is a book for urologists preparing for the exams. It did not make sense for me to just publish one book and then publish the next one 2-3 years, because then the students that will have an exam next year, they are not up to date. So I will try to, my goal is to publish every year a fresh book with the latest recommendations. So advantages about the flowcharts. It's a rapid visual way to consult the latest recommendation. If you are at the clinic, you forgot second line treatment for, or when should a patient receive radical inguinal lymphadenectomy by pineal cancer, then you can check the flowchart. And it's easy to memorize or follow or memorize for the exam. But there are disadvantages when we work with these flowcharts. They are only relevant for clinical practice. So it means to study, we have to study everything and then summarize it with the flowcharts. And it does not state the clinical significance, the level of evidence. So if it's strong or weak, the recommendation, it's not written in these flowcharts. Another thing about these flowcharts is they are a result of the guidelines. So the guidelines, it does not demonstrate all the possibilities. For example, they recommend MRI for suspicion of prostate cancer and then after biopsy. But if there is no MRI, then the flowchart does not show this option. So that's the restriction of this kind of work. It does not show all the possibilities. So I'm still working on a flowchart, but I wanted just to share with you the latest 2 flowcharts that are already ready. So the first one, here is the renal cell carcinoma from 2022. You see on the left up, it starts with the diagnosis. We know usually it's with CT or ultrasound. Then we categorize the stage, the tumor, and then there are the therapy options. Usually they are surgical ones, partial nephrectomy or radical nephrectomy. And then if the patient refuses or is too ill, then there are other options like cryoablation or radiofrequency. And then on the right side, you see the handling of metastatic disease. And we know that we have to categorize the patients through the EMDC score. And here are the systemic therapy options. So now we will see the changes for 2023. So there are not big changes, but they wrote in the EU guidelines, which it makes sense. It was not written before. It's if we have a patient with a big tumor T3 or T4, And if it's unresectable, if we cannot do the surgery, then there is an option to do a biopsy and see if it's papillary or not, or other chromophobe or the clear cell, and then choose the appropriate systemic therapy. And then we can see if the patient responds or not to a deferred resection, or if the patient is not fit enough for the surgery and the tumor is still unresectable, there is also the palliative management. Another change in the latest guidelines from renal cell carcinoma, it's here on the right, for the treatment of papillary renal cell carcinoma. They gave another alternative options when cabozantinib cannot be given. They wrote that we could give nivolumab plus cabozantinib. And that here at the end, in the later lines of therapy, they wrote, if in the past cabozantinib and nivolumab were not given, then that would be the choice for the next treatment lines. Another cancer, it's another cancer. This is also a big flow chart, especially because of the new EAU prognostic factor risk groups. I had to find a way of putting everything, all the information about the stratification. And the changes of the bladder cancer management, I also put it here. So it was very interesting. They wrote that for patients that have a low risk or intermediate risk, and they cannot receive the postoperative single instillation of chemotherapy, usually mitomycin, other option is through irrigation with water or saline fluid. So the idea is that if we clean the bladder after the surgery, it's also a good option when we want to clear out or reduce the risk of recurrence. They also gave the option of if we have patients in the low risk group that they had the surgery and then they go to cystoscopy 3 months later and we found the tumor again and we think that it's a low risk, they gave the option of an active surveillance. Another change in the guidelines, which is also interesting, it's when we go through here, the patients that had more than T2, muscle invasive, they should receive neoadjuvant chemotherapy and afterwards radical cystectomy. And then when it comes out radical cystectomy with T3, T4 or positive lymph nodes, they gave as an alternative, they recommend as an alternative to adjuvant chemotherapy, adjuvant nivolumab. So immunotherapy, it's now a possibility, a therapy choice, an alternative to be given adjuvant after radical cystectomy. And a big change also in the metastatic setting, when we go like after the first and second line, in the last guideline from last year, it was written enfortumab vedotin clinical trials on and now it's we can use it. It does not, the patient does not have to go to a clinical trial. So here are the summaries. Now you have an idea how it works, the process of doing these flowcharts. And I thank you for taking the time to listen about this masterclass. And again, I'm really happy for your invitation.